Hello, and welcome to the WHN broadcast. I'm your host, Karen Ruby. Today we have another Business Spotlight series. Kara, would you like to introduce your business and describe the COVID mitigation measures you have in place?
Certainly. Thank you for having me, Karen. Hi, my name is Kara Darling, and I'm the clinical administrator of Lighthouse Complex Care. We have two clinics, one in Delaware and one in Colorado. And we are dedicated to making sure that our patients are safe and from all kinds of pathogens, but particularly COVID. And so I'd be happy to share some slides that sort of talk about the ways that we keep people safe. So you'll just let me know when you can see my screen.
Here we go.
All right, so this is our front door, Lighthouse Complex Care of Delaware. And when you come into our clinic, we utilize what we consider our Swiss cheese layer model. I'm sure you've probably seen this graphic. It's circulated around. I just pulled the one off from the New York Times, but these are our Swiss cheese layers of mitigation that we employ in our clinic to make sure that our providers and our staff, as well as our patients, are safe from COVID-19 infection. And so just wanted to share a little bit about each one of these layers, how we utilize them, and why they are important to us. So when you walk in the door, you'll obviously see some of these layers visible. First of all, you'll notice that in our reception area, you're not going to find a lot of people hanging around. We are, doing the sort of wait in your car until your appointment model. And then, one family will come in at a time. You'll just let our fully masked and properly masked receptionist know you're here. And then you would go directly into an exam room to minimize contact with anybody else in the clinic. I've sort of circled here, and I'll talk about each one, but I've circled some of our layers of mitigation. We have our carbon dioxide monitor visible for everybody to check their ventilation. We have for UV. My little arrow off to the side is just showing that we also have an air filter here that you'll see in a minute. So just wanted to point out again that there's multiple layers when you walk into our clinic that are keeping you safe and your family safe. So our first layer is universal masking. Of course, we all feel the crunch with masking in healthcare situations no longer being mandatory, and masking is just basic infectious disease 101. Like, it really makes zero sense to go to a healthcare provider and be worried about the fact that you may get any kind of transmissible disease, but particularly COVID in this case. And so we definitely want to make sure that everybody in our clinic is masked. We make sure that people also wear their mask properly, over the nose, not around your chin. And if people don't have a mask when they come into our clinic, we provide them at no charge. We use auras, individually packaged auras for our adults. And for our children, we use the little, they're the small halyard duckbills. The only exception would be a special needs person in our clinic that couldn't mask, and we would get them, again, directly into that exam room. But all of our staff and everybody who comes into our clinic will wear a N95 quality or better properly worn mask as the first layer of mitigation. Our second layer of mitigation is that we post our carbon dioxide levels. We use the AirNet, which is sort of the standard kind of classic monitor. And that is so that you can be assured that our ventilation is up to speed and working properly. And most people know that around 430 is the outdoor ventilation. We run a little bit above that, but as long as your carbon dioxide levels are below 1,000, you're doing pretty good. And ours run pretty consistently around 500 or 600, and that just lets you know that you're not rebreathing a lot of the air that other people have breathed out. We want to avoid that. So we have our masks to help us avoid that, but we also have our ventilation system that allows us to feel confident that we are breathing only our own air. And then we also have at least 12 air exchanges in occupied spaces. And so, again, we're cleaning the air. We're constantly making sure that we are removing viruses and even airborne bacteria, dust, pollen, any kind of pollutants. And we want a minimum of 12 air exchanges per hour in every occupied space. And so that would be equivalent to hospital grade, some sort of surgical ventilation in our clinic. A lot of our spaces actually even have more than 12 air exchanges. This is our bathroom. We have a little Medify in our bathroom. And in every occupied space, you'll see we use a lot of the clean air kits because they're really great. They're super quiet and they give you a lot of like bang for your buck in terms of air exchange, but we use the Healthy Glows in a lot of our spaces. This is that other side of the reception area. So again, you're not seeing the chairs where we're asking people to sit there and congregate. You're seeing, again, our air filters. This is one of our exam rooms. You can see the little Healthy Glow over here in the corner. Here's another exam room with our Healthy Glow there to make sure that everyone understands that we are continually cleaning the air. So we're well ventilated, we're masked, and we're cleaning the air. Then we've also added even a step further, and that is the FAR 222 nanometer UV lights. And we are really excited about this because it's really a game changer in terms of being in a public space to have a light that will actually be actively killing COVID in the air and continually killing COVID in the air. So we really like our sterile ray units. This is a 60-watt sconce that's right in the entryway, and it covers our whole reception area and even down the hall almost to our first exam room. And then we're installing these also in our exam rooms so that we can make sure that, especially again, like I said, if we have the special needs patient who can't wear a mask, we know that we have these lights that are also killing COVID if they were to happen to be asymptomatically infected. That's another note. We also, if people have symptoms, we ask them not to come in, to reschedule their appointment, to stay home, or to do a virtual visit. And then we do have the 150-watt Sabre that is portable. So if we are going to have, for example, we have a couple of patients that come in and they have their case manager and their personal aide and their loved ones are with them, and so there might be extra people in a space. We can always pull the Sabre in for extra disinfection. We also use it on the staff side if we're having a meeting or more people in a space. And we just want a little bit more protection, then we can bring the Sabre in addition to the sconces into a space. Then we're still universally testing here, and we're universally testing with the best test that we could get for that was still cost effective for us to absorb. So we do take all major insurances, so we're not a private pay clinic. We take Medicare, we take Medicaid from several states, and we absorb the cost of the mask and we absorb the cost of the testing because it's really important to us that this is universally accessible to our patients. We don't want cost to be an impediment to people staying safe. And so we've chosen the FlowFlex Rapid because it has the best data that puts it on par with some of the NAT tests. We eventually were looking at some of those like the Q or the Lucera before they were bought out by Pfizer, but we couldn't absorb, those are more expensive, and we couldn't absorb those costs, and we didn't want to pass any cost on to patients. And with the data on the sensitivity of the FlowFlex, we felt comfortable using this. And we don't just test the patients when they come in, we also test whoever's with the patients. So again, it's a universal testing model. Our staff tests twice a week. But anyone else who comes in the door, they come in, they go directly into the exam room. The first thing we do is their antigen test to make sure that we don't have any asymptomatic infections hanging around that could throw us off even with all of our layers. So, and then the last thing that I say is our sort of our final layer is that we are a hybrid clinic. So we have virtual visits available. Anything that we can do virtually, we will. Our Denver clinic actually is still operating completely virtual. We were an in-person clinic until 2020, and then we pivoted virtual, and we haven't actually brought that clinic back into a public space yet. But our Delaware clinic opened in July, but still, even through our Delaware clinic, you are welcome to have a virtual visit. Like I said, say you had some symptoms you were worried about and you needed to talk to somebody, but you didn't want to come in and bring that, or maybe you're just still avoiding the public spaces like a lot of us are to avoid infection. We do give patients that option. And so it's just really important to us to be accessible healthcare, to be quality healthcare, and to avoid breaking any trains of transmission. That we want them to stop with our clinic. We want people to be able to safely get the healthcare that they need.
Wow. This is so great. I'm wondering what the effect has been of all these measures on your customers and your patients and your staff. What's everyone been saying about it?
Well, I mean, beyond just, not catching COVID or transmitting, COVID infection, what I really found, and what I also experienced personally, is that our clinic offers a relief from the anxiety of having to seek healthcare. I mean, already a lot of times when people are coming to their healthcare providers, it might be uncomfortable. They're sick or something's the matter. It's not something that we all just go, oh, hey, this is a great activity to have fun on a Saturday night. I'm going to go to the doctor. We all have a reason, right? And so having to have a layer of anxiety on that. Okay, so I'm going in there, and am I also going to catch COVID on top of that? Am I going to have to deal with long COVID and the sequelae that come with that? I'm just so worried and stressed about even being here. How am I going to absorb the information that my healthcare provider is giving me? What we've noticed is that we can take all that away basically for our patients. And so while it's still a little stressful to come to the doctor, if you know that in our clinic, our providers care about keeping you safe, and we've set up the clinic to give us the best odds to stop any transmission chains, it just seems to be a sort of a sense of relief, like an oasis for patients to be able to come in and get the health care they need without having to worry about, catching a disabling virus.
Incredible. I think our viewers are going to want to know more about your clinic and who your patients are and how they could become one if they are eligible. So, can you tell us more about who you see and what your clinic is all about?
Absolutely. So we are first and foremost, I need to say we're not a primary care clinic. So we're not the kind of clinic that you would come in to get, school physicals done, or, well child checkups, or even your sort of routine ailments, sore throat. I've got, some sort of typical kind of common illness. That's not what we do. We are a care coordination clinic for people with chronic conditions. And so to be seen at our clinic, you need to have 2 or more chronic conditions that are expected to last at least a year, and would put you at risk for decompensation. Now, it's not quite as complicated as that sounds. It could be something as simple as, oh, well, I have, hypothyroid and some, hypertension. Or it might be something as complex as I have epilepsy and autism, and an immune deficiency. We see people with genetic disorders. We see people with dysautonomia and POTS. We see mast cell activation patients. We see all sorts of encephalopathies, autoinflammatory and autoimmune kinds of encephalopathies, mitochondrial dysfunction, and we do treat long COVID. And so that's another reason why it's really important for to us to stop the transmission chain. We see firsthand the serial effects of reinfection, and we measure them. We have a standard lab set for every patient that has had COVID, and we run it every time they get COVID, and we track the different body systems. So we have a pretty good idea of what's going on in patients' bodies as they become infected or reinfected. And so long COVID, we picked up long COVID pretty early, probably with some of the first long COVID cases that were coming out, and have been fairly successful at being able to help people mitigate the effects of infection as well. So those are the kinds of people kinds of patients that we take. Now, I also should say you don't actually have to have necessarily a formal diagnosis. You could have a suspicion of a chronic condition. So you could come in and say, oh, well, I'm worried my mother had celiac disease and autoimmunity, and maybe your grandmother had, lupus, and you want to be checked out and see if that's something that's going on in your body. Maybe you have some gastrointestinal issues and you're not really sure. So you could also come in, with the suspicion of some of these things. And what we do at our clinic is we have a sort of a diagnostic algorithm that makes sure that we check all of your systems. So your neurology, your immunology, your gastroenterology, we run through our test to make sure that everything has been thoroughly evaluated and diagnosed. We will send you out to specialists. So, if you may say you need, follow up on an EEG, we'll send you to neurology, and then we'll come back. And for people in our clinic, usually there's more than one specialist involved. And so if people have 3 or 4 doctors and they're telling them to do 10 different things and they don't know where to start, then we take those plans, we consolidate them, and we make a list of what's feasible to implement in the next 2 months. So we'll say, here are the top 3 things we want you to do in the next 2 months before we see you again. And here's how you do them. And if you need help doing them, please let us know, and we'll walk you through how to make sure that you get them done. And then when you come back for your follow-up visit, the first thing we do is pull up that list and say, okay, did you get these 3 things done? And you say, I only got 2 done. And we say, that's fine. We'll take this one and we'll put it on the list for today. And then here's 2 more things, and we'll work through the next 2 months. It's a step-by-step approach to make what can be overwhelming, especially with some of the conditions that we treat, manageable. And again, accessible in a different way, right? There's cost accessibility, and then there's logistical accessibility. So we just want to make sure everybody gets the care that they need.
This has been really super great. And I know you do the virtual telehealth. Can people live anywhere and see you, or are there certain states that people have to live in to see you?
So I think the easiest way to answer that question would be to pull up our website, if you don't mind me doing a screen share again.
Yes, that would be great.
Okay. And so basically, if you go to our website, you can see that you choose your location, join us in Colorado or join us in Delaware. And that basically sort of pick the one that's closer to you because we're more likely to be licensed in your state if you're obviously closer to the clinic. So I'm just going to click on Colorado right now. When you click on Colorado, you can see right here there's a telehealth tab. And so we actually have a rolling list here. Colorado Clinic sees everybody by telemedicine, and these are the states that we are licensed in to do telehealth through the Colorado Clinic. There's a separate list of states that we're licensed in to do telehealth through the Delaware Clinic. And you should also note that you don't have to live in the state to get care. You can actually, maybe live in a neighboring state and, pop in the car, head over to a Starbucks parking lot, jump on their Wi-Fi, and, be located in a state where we have a license during the visit. So that is it's a legal requirement, and they really started cracking down after they rescinded the EUAs. So telehealth sort of opened up during the pandemic. Before the pandemic, it wasn't very well defined, and so people were doing it different ways. Then in the pandemic, it blew up, right? And so then all of a sudden the state said, oh, we're going to start regulating it since it's blown up. And we were still sort of operating under that federal EUA protection, and we were seeing people basically sort of coast to coast. We also see patients in other countries, quite a few other countries, to help with their care coordination and their diagnostic pieces. But anyway, in May, when that law changed, they got a lot more specific about exactly not only who you are allowed to see, how you have to document that so that we can bill insurance for it as well. So, but you can do that for either site. You can come in and you can see which states we are able to service. And you can always also give us a call and let us know if you are interested in being seen. Actually, I'm wondering where my list is here. Oh, my rolling list is here. I'll have to fix that. But my telehealth tab is missing. You sort of see. That's my bad. Web maintenance, clinic logistics, COVID prevention, that's me. But anyway, you can also call our clinic and we're happy to talk to you and explain to you how we can see you or where we can see you or what's the easiest way for you to, to get care from us.
Excellent. Really great. Thank you so very much for all of that. Is there anything else that you wanted to share before we close this really informative talk?
I guess the most important thing, well, there's a couple of important things to me. One important thing is that people don't despair. And a lot of times when I see people look and it seems overwhelming because, there's no mandates anymore. People are not generally masking. There's a lot of, sort of cognitive dissonance about what we know that COVID does to us and what our, the powers that be tell us and how hard they make it to keep ourselves safe. There are tools out there though, like we know if you're in a good quality quality mask, and especially a fit tested mask, then you are really, really increasing your chances of avoiding the virus. Maybe you don't know about the at-home NAT tests that are PCR, like quality, that you can access now that PCR has been sort of hard to find and insurance is not, as good with coverage. Maybe you've never heard of the FAR 222M UV lights that are safe for you to be in at occupied spaces and can, help kill COVID in the air. So keep looking for those tools. Keep reaching out to communities like WHN or some of the other COVIDing communities that are around, and keep finding those ways to do the things that give your life meaning safely. And if we all band together and we do these things together, then the demand grows from a grassroots perspective, and we'll have more safe spaces and more ways that we can come together in community, and for our needs, for our business needs, our shopping needs, our healthcare needs. Demand sort of drives our economy and accessibility. So the more people can see that we want them to wear masks and we want to keep each other safe, or we want these kind of mitigations in business, then the more of them there will be. My second sort of addition would be, make sure when you get COVID that you have a healthcare provider that understands, the stuff that comes after, the sequelae that COVID causes. We run that standardized lab set that I mentioned earlier on every patient who's had COVID, every infection. So anytime obviously with this lack of accessibility in healthcare and basic needs, you may catch COVID. Like it's very hard to avoid, but every reinfection that you avoid does help. So catch it the minimum number of times possible. And when you do, make sure you're going in and your provider's checking your liver, checking your kidneys, checking your inflammatory markers, checking your heart. They're taking you seriously, and they're making sure that you have the best odds of, knocking out any neurological inflammation that's ongoing, or anything else that's happening in your body. Sometimes if you don't look, you don't know. And then, 6 to 9 months down the road, you have a more advanced condition that could have been, avoided by detecting it and treating it really a lot earlier. So that would be my other piece of advice.
Amazing. Thank you so much, Kara. We really appreciate you taking the time to share all this with us. And all of the information of how to find Lighthouse Complex Care is going to be on the screen. Thank you again, and hopefully we'll get a chance to talk again soon.
I would love that. Thank you so much. And for all the work that the World Health Network does, we really appreciate it.